maybe for those who don't understand what exactly spinal fusion is and maybe why you should get one, maybe just briefly describe that, and then also the alternative to awake spinal fusion that you're doing now.
Yeah, that's a great question. So, of course, as the population ages and we're seeing more and more of the baby boomers entering the later years of life, spinal conditions, as you know, is an increasingly prevalent problem. Probably the number two or number three reason why people see a doctor for any reason beyond just a common cold. So back pain, sciatica, pinched nerves are very common disorders. Thank God we have great physical therapists, of course, that can take care of these kind of conditions. And then pain management as a field is really evolving. So for the majority of people who have back problems, pinched nerves in particular, there's a lot of non-operative measures that can help. But of course, there are times, and the reality is that there are times when surgery is a better answer. For those people who have tried conservative measures, tried physical therapy, tried pain management, and even for those who just need to get back to work quickly, surgery provides a quick fix for the right patients. I've been doing spine surgery for 15 years now, and I'm still in awe of the outcomes that we get. I mean, people are in such pain. And when we go in there and do a surgery where we unpinch their nerves, by the next day, they're perfectly fine. It's absolutely amazing. So it's about quality of life. So for people who have pain that goes from their back down their leg or from their neck down their arm, typical radicular symptoms, who failed conservative measures, including physical therapy and injections, spine surgery is a great option. Spinal fusions in particular, there's a lot of controversy around spinal fusions. I think, unfortunately, for a variety of different reasons, spinal fusion surgery has gotten a bad rap in the lay press. But for patients who have, let's say, an instability of the spine, so for example, the joints in the spine become loose and the bones become sort of wobbly, for those people, they need to be stabilized, and a spinal fusion surgery is an excellent surgery. Or for people who've had previous spine surgery and need to have another one, sometimes a spinal fusion surgery is necessary. So typically, when someone has a pinched nerve, I say this all the time. My goal as a spine surgeon, I unpinch nerves. So when someone has a pinched nerve, I unpinch them. I may unpinch them with just doing a simple operation called a laminectomy or a discectomy. But sometimes if they have a pinched nerve and instability, I need to do a laminectomy plus the fusion to stabilize them. That's typically what we do. Now, what was interesting about what we're doing though is a spinal fusion surgery across the country can be a 2 to 3 hour operation, and people stay in the hospital for about 2 to 3 days. And across the country, people are on narcotics for 4 to 6 weeks. What's been driving our Awake Spinal Fusion program is a few things, mainly because what we're trying to figure out is how to make a spinal fusion surgery an outpatient surgery. Basically, I always tell my patients that if I do my job properly, you should forget that you had surgery because the experience is so good. So at this point now, an awake spinal fusion is really just a combination of using local and regional anesthesia to do the spinal fusion surgery. It takes about an hour and a half to do. Patients go home within 4 hours. They're on pain meds only for 3 to 5 days, and they're typically back to work within 1 to 2 days. So the national average is people stay in the hospital for about 2 to 3 days after surgery. Our patients stay for 4 hours. The national average is to be on narcotics for 4 to 6 weeks. Our patients are on pain meds for only 4 to 6 days. And then I don't have good data about return to work, but our return to work data is about 2 weeks.
That's incredible. And for those who may not understand what outpatient is, it's just instead of going to the hospital, you're doing like going to a facility not connected to a hospital that will allow you to get surgery. And what are some of the benefits of making this outpatient? I mean, you've highlighted some of the stats where like people are returning to work sooner, they're going home sooner, they're having less, they're not on pain medications as long. I guess, is there other additional benefits from this being an outpatient surgery versus inpatient?
What's interesting actually is that because of COVID and for a variety of different reasons, a lot of people are just scared of being in the hospital. Yeah. They don't want to get an infection. Perhaps they don't like the food. But the one thing I learned actually, the most telling one story was this. When we first started doing awake spinal fusions, didn't really think initially about sending them home the same day. But I had a patient in her 70s. I still remember this story. Patient said, beautiful lady, really nice lady. I get a call like around 7 o'clock at night that she wants to go home. And said she wants to sign out AMA, against medical advice, meaning that she doesn't care what's happening. She wants to go home. Long story short, she went home, and I said to her the next day, or when I saw her afterwards, I said, why did you want to go home? Like, why wouldn't you want to just stay in the hospital? She goes, Doc, look, I'd called for some pain medicine, right? And the nurses were busy. They're taking care of other patients, which I perfectly understand. And they couldn't come serve me till about half an hour later. She goes, look, if I was at home, I would have been able to get up, go to the cabinet, and get the pain made myself. So for me, it's about having control.
Mm.
It's for me about being able to control my own care. And I think that most people believe that. Yeah, there's some people who really want to have someone holding their hand, but I think majority of people, they want to have control of their care. So they want to be able to go home, sleep in their own bed, make their own food, take pills when they want to. They know enough, I believe. And so for me, outpatient is more of a mindset than anything else.